A 35-year-old man presents to his doctor with red, swollen right upper as well as lower eyelid, worsening over the previous 2 days. He is unable to open them. He feels unwell and has a high temperature. He also has a history of chronic sinusitis 4 years ago and glasses wearing 10 years. Our examination reveals the following. In the case of this case, this is a classic case of right orbital cellulitis. This is right orbital cellulitis. This is clearly an infection. And in the case of right orbital cellulitis, you already get one of the symptoms of orbital cellulitis, and that the patient will come to you with loss of vision along with eye pain, so acute painful visual loss. But not just that, they'll have the two hallmarks of orbital cellulitis. He has to have proptosis, which he does have, and number two, he has to have what is known as restricted ocular motility or ophthalmoplegia, meaning he cannot move the eyeball at all. So the vision is affected, and you will also see that typically patients, they look like their eye is closed. Their eye is closed and it's red. So you can think of orbital cellulitis as that way. So the symptoms of orbital cellulitis is clear: acute painful visual loss. And when you look at the examination, full ophthalmic examination sort of picture, you'll see that there's redness in the eyelid, in the conjunctiva. There will be severe swelling, severe proptosis. He'll have ocular motility. He can't move his eye at all. He can't even open his eye as well. And on top of that, he has fever, he might have discharge, photophobia, redness in his eyes, many things, even pupillary defect, okay? There's a lot of things. And typically when we mean by orbital cellulitis, because this is typically caused, mind you, both of these are typically caused by a past sinusitis infection, okay? So if a patient had a past history of rhinosinusitis and it was untreated, especially in, let's say, in the ismoidal sinusitis, then in that case it can transfer to the eyeball and infect the eyeball. The only difference is that will there be inflammation behind the orbital septum or in front of the orbital septum of the eye? If it's in front of the orbital septum, if there's inflammation of the periorbital tissue, the tissue surrounding the eyeball in front of the orbital septum, no, they call this pre-septal cellulitis, near the septum. But if it's inside the eyeball, if it is behind the orbital septum, okay, then in that case it's going to cause inflammation of the muscles and the fat. And in that case, in the case of bacteria, most commonly staph in this one, orbital cellulitis will occur. And that's why there's protrusion, proptosis in orbital cellulitis. But when you look at pre-septal cellulitis, there's none of that. There might be fever, there might be discharge, there might be chemosis, which is swelling of the conjunctiva, there might be lid swelling and erythema and warmness, but there's no proptosis. There's no restricted ocular motility. The vision is completely normal, okay? It's much less severe compared to orbital cellulitis. So a lot of the things like proptosis and ocular motility, they're absent in pre-septal cellulitis, but they can come with acute painful visual loss. That is something also to keep in mind, okay? Let's remove that real quick. And let's look at the image. So in orbital cellulitis, like we saw in the case, it can look like this, basically very shut-off eye. Or in the case of pre-septal cellulitis, you can have redness and erythema and swelling in the eyelids. And you can see a little bit of affected eye. The eye might be a little bit affected with swelling of the conjunctiva, chemosis, but that's pretty much it. Pre-septal cellulitis is pretty much tame. It's mild, okay? So that's one of the key differences between the two. Besides that, it's the same for both. Really, investigation for orbital cellulitis, you'll do full eye examination, the whole 9 yards. You'll also do blood culture to determine the bacteria, and then you'll do a CT scan. Especially in orbital cellulitis with proptosis, you have to do CT scan because you never know. There might be an orbital abscess, and if there's an orbital abscess, you'll have to do surgical drainage, okay? But it's not as necessary in pre-septal cellulitis. Regarding treatment, for both really, we'll do systemic antibiotics. IV is preferred for orbital, which is an emergency taban. While pre-septal is less severe, we can use oral antibiotics. Regardless, you'll use systemic antibiotics followed by lid hygiene, followed by warm compressors, and of course the patient would be admitted to the ER during the midst of all this, okay, to control the bleeding. Of course, if you have an orbital abscess, such as the case in orbital cellulitis, you'll do surgical drainage, okay? So that's the key difference between the two, and that's pretty much it for the case, okay?